Here's what we'll do in this data challenge.
So your deliverable or end product you will be making through Airtable will be looking something like this. Turning one PM2.5 data point into a story. Once you put in your data point, you will automatically be given this phrase. For example, in Los Angeles, California, many residents were exposed to pollution levels above what is considered safe. So we actually have a narrative about chronic disease risk and environmental justice.
The plan: find local data for your region on air quality.
Use free, publicly available air quality data, build foundational data skills, and create something that can live in the world, the real world. Data is essential, but it doesn't create change on its own. It's only powerful when people can understand it and use it.
My name is Shamini.
Diana Saad.
Tracy Flood.
Janelle James, and I am excited to welcome you all to BroadStreet's Data Challenge.
I am here to guide you step by step so you can leave the session with practical skills that you can apply right away.
Now we're going to be moving into the step-by-step. You'll be learning how to explore and find the data and then to create the portfolio project. We provide the templates for those portfolio projects.
So let us pretend we're a collaborative of public health departments writing a community health assessment. So if we find data, for example, in Los Angeles, California, the PM2.5 is 15.6 micrograms per cubic meter. That doesn't really complete our story. So when we compare the national air quality standard, we actually have a narrative about chronic disease risk and environmental justice. So your deliverable or end product you will be making through Airtable will be looking something like this. This is a pretend example of how our deliverable or phrase can be used for a community health assessment. This pretend example is for Los Angeles County, California. The red arrow is pointing to the phrase that we saw earlier that you will generate on Airtable based on a county of your choosing on the data that you will be inputting. So in 2020, the average level of PM2.5 in Los Angeles County, California was 15.6 micrograms per cubic meter, which was higher than the national air quality standard of 9 micrograms per cubic meter, set to protect public health. This means that many residents were exposed to pollution levels above what is considered safe. So breathing in high levels of PM2.5 over time can increase the risk of serious health problems, including heart attacks, asthma, and stroke. So that will be the end product.
Air quality, especially exposure to PM 2.5, affects every aspect of public health.
Breathing in high levels of PM 2.5 over time can increase the risk of serious health problems,
Asthma, lung disease, heart disease, and stroke.
and poor infant health outcomes, birth outcomes, such as low birth weight or even stillbirth. PM 2.5 stands for fine particulate matter, that is 2.5 micrometers in diameter or smaller. So to put that into perspective, these particles are about 30 times smaller than the width of a human hair, which means we cannot see them with the naked eye. PM 2.5 is produced by sources such as wildfires, vehicle exhaust, and power plants that burn coal, oil, or natural gas.
Because it is so small, it hangs in the air, it goes deep in the lungs, and it can even enter the bloodstream. The World Health Organization has set 5 micrograms per meter squared as the concentration goal. At the moment, the EPA threshold, the health-based primary threshold, is 9 micrograms per cubic meter. Different organizations have set different health-based thresholds. Now we're going to be moving into the step-by-step. We'll be learning how to explore and find the data and then to create the portfolio project. We provide the templates for those portfolio projects.
Today, just to recap, we'll be learning how to use Airtable. You will find county-level data, local data on air quality, and be able to insert that data into a record on Airtable, turning one PM2.5 data point into a story. So by the end of the session, you'll be able to input and organize data into Airtable, and then also you'll be comparing PM2.5 exposure in a specific county compared to the National Ambient Air Quality Standard, which is 9 micrograms per cubic meter. You will also be finding another data point, asthma, to complete our data story. Create a phrase or deliverable that could be used for community health assessments. So what is Airtable? Think of it as a mix of Excel, Google Sheets, and Project Tracker. But it's smarter because it allows you to manage more complex data without needing advanced technical skills such as coding. Airtable helps you create a story with your information. You can organize information such as health indicators, data sources, community partners, stakeholders, and more. Actually, one of its strongest features is automation, which allows users to create workflows that automatically trigger actions based on specific conditions, making Airtable a powerful tool for managing public health data. So now time for the data hunt in order to create our phrase. First, we will be collecting data on air quality. That will be our main finding for our phrase.
We're going to start here. The National Environmental Public Health Tracking Network basically tracks a wide range of topics that relate to health and the environment, and they contain a ton of data on these topics. For our purposes, we are specifically interested in air quality data. To get that data, we'll be navigating to the Data Explorer tool.
The first thing that will pop up is this query panel. We're going to choose air quality. Your indicator will be current and historical air quality. The measure will be PM 2.5, highest annual average concentration. This is going to include monitor plus model data. And for your geography type, you can either do national by county, that's going to show you all the counties, or you can do state by county. I'm going to do California and choose 2020. Press go. So here we see the map, okay, and California and all of the counties. And you'll see the average, which is 15.6 micrograms per cubic meter. So we'll be putting that data point into Airtable. Next, we'll be finding prevalence of asthma among adults, just for extra practice with the EPH tracking tool and Airtable. This will also further complete our story and may back up our claims that PM 2.5 concentration does have a negative effect on health outcomes. So back to our map, our tool, I'm just going to press clear data up in the top, press OK, and then I'm going to select data once more. So based on this slide right here, we're going to put in step 1, asthma, our indicator, which is prevalence of asthma among adults, and our measure, which is age-adjusted prevalence of current asthma among adults, and they have just model-based and then county. I'm going to do state by county, so California. And just to keep the years concise, even though we have a more recent year, I'm going to pick 2020 just to keep our data points concise. Press go. So again, I can hover my mouse over and find that the percent is 9.2. So that will then be placed into Airtable as well. Now we're just going to hop right into Airtable and get started. So here is the Airtable template. So you're going to start here in this tab, and you're going to look at it in grid view. In the first column, we have summary. This was formulated, so once you put your assignee, so you're going to start here, once you put your assignee, BroadStreet Data for Change program, that's me. I'm going to put my name, my county, Los Angeles, and then my state. And so this will automatically pop up as BroadStreet Data for Change program, Los Angeles, California. So I don't need to actually go in and type this all out because I put this formula in here. Now, for the state, you're just going to do a drop down because I actually linked this column to the US states tab right here. So you can actually link different records to each other. So that's an important aspect of Airtable. I will then put in the first data point, which is the highest annual average concentration in 2020. That was 15.6 micrograms per cubic meter. I will then put a drop down. So it's going to be higher, lower, or the same to this 9.0 micrograms per cubic meter. Again, this is the National Ambient Air Quality Standard average. Then I will add the percent age-adjusted prevalence of current asthma. We said that was 9.2, and from our findings, it is lower than the 10%. This is an average that was calculated from the EPH tracking network. And then a phrase will be formulated. Again, this is also a formula that we included based on what you have inputted in here. So what you've inputted for the highest annual average concentration in 2020, and then your county, your state, which was higher or lower, so that was included as well in the phrase. 9, higher than lower, the highest annual average concentration, then 9, or the same, and then the rest of our phrase. This means that many residents were exposed to pollution, just like our slides. So just going to expand this a bit so you can see the entire phrase. So automatically, once you put in your data point, 15.6, or whatever your county data is, you will automatically be given this phrase. So again, it saves a lot of time. Then what's cool about Airtable is we actually get some AI features. Right here is actually a picture of LA County that AI has generated for us. You will then put in your data source. You can also look at Airtable in a different views. We have grid view, which is what you'll put your data in down here. You can also look at in gallery view, so it'll show you your complete record. Again, your assignee, the county you have chosen, the linked record of California for the state, your highest annual average of PM 2.5 concentration, whether it's higher or lower than the national ambient air quality, so it's pretty high. And then your phrase, which you can then import it into your community health needs assessment. Of course, your data source and this little AI generated image. And just to add some extra information, asthma among adults, as well as it compared to the average of the national states that they have at the EPH data tool. You can also look at this Kanban view as well. This can be stacked by different measures or fields. You can do assignee stack or county average, status. I'll keep it at county average right now. So with Airtable, you can really make it your own. For the sake of today's assignment or challenge, you will just be putting in your data. Okay.
Thanks for doing that. It's a really, really good time to just give it a shot first time through. The best way to learn is to try. Data is a little bit like music. The only way to learn how to make something with data is to practice. The template kit is provided. It's a really good chance to do it.